I have my son, 10-year-old son, Stephen, sitting with me. He has cystic fibrosis, a cruel respiratory illness. Obviously, we're concerned, with the coronavirus and the effect that could have possibly on him.
Obviously, his condition is something that you'd be worried about in normal circumstances. How much have things changed for you as a family?
Oh, it's changed a lot. We're having to restrict our outings. He races BMX, so obviously we're very cautious of contact with other people and the possible risk of him catching it from somebody else and the consequences of being in hospital, because he can go into hospital at very short notice as it is.
And what's the reality for your son if someone in the family or in close quarters contracts coronavirus?
We would have to isolate. It's extremely serious, and there's the possibility that, if he was to get it from us, that he might not survive.
Do you think Australians understand that reality at this point?
No, I don't think they understand the seriousness for these particular vulnerable Australians, and they're predominantly young Australians.
And why is it so important for you tonight to come on and ask this question and put your case to the government and to the public?
To prioritise, to ensure that we've got access to products and services.
I mean, it's an extraordinary situation clearly facing many Australians. We've had so many questions from people in different but similar sorts of circumstances. Can you say anything to families like this that are clearly terrified right now, Senator?
Well, clearly this family would be more aware than most other people in the community of the potential impacts on their circumstance, because they are in a situation where they have to practice a lot of the things that we're saying to the Australian community now that you should do. They've already talked about the fact that given what's happening, they need to socially isolate more, because they know directly, because of the fact that their son has cystic fibrosis, what the potential impacts are. They're in perhaps a unique situation in that circumstance. And again, that's one of the reasons that we want to try and minimise the impact on the broader health system, so that the health system remains there and available for their son in the circumstance that he has a need for it. And that's one of the whole purposes that we've been following the advice that we have.
Is there any way to rectify the uncertainty? I mean, that's what we hear from so many people. They just can't get answers. They try all the different authorities at state, local, federal level, and they just can't get an answer about whether their child or themselves will be looked after.
Well, the whole point of what we've been trying to do is to, as we've said a number of times tonight, reduce the rate at which this disease works its way through the Australian community, so that we can make sure that those who do contract it can be looked after, but so that the services remain available for everybody else. It's one of the things that we talked about at the forum that we held for the aged care sector the week before last. We're largely talking about the same workforce. When we're talking about workforce need, it's the same workforce that we might need as a surge workforce right across the entire health sector, whether it be in residential aged care, home care, or the acute health system. It's going to be the same workforce that we're looking to step up. That's why managing that workforce, making sure it has some capacity and availability, is going to be extremely important. That's why we're putting some resources into ensuring that's the case. If an aged care facility has a circumstance like occurred in Sydney, we can put additional people in there to cover off for the people who can't come to work because they've contracted the disease and need to self-isolate because of that circumstance. They're the sorts of things that we're trying to achieve.
But Sam Mostyn.
Sorry to interrupt, Minister. I think Christina and her family presents us with the perfect moment that we've all got to sit and rest with. If we can't support the most vulnerable in our community through this time, we've all failed. And that's why I think we've got to keep thinking about what is the common good and how do we support the common good. And one of the ways we can do that is to think very creatively and differently about the situations of the most needy that will teach us about what we can do across the entire society. So if I think about the disability services sector and the world that Christina lives in, my family has lived in and dear friends have lived in, we need to be conscious of the fact that right now we've got an NDIS with $22 billion guaranteed that needs to be opened up and made flexible and work well for those that need a bit of creativity and a bit more flexibility to actually pivot quickly to get support, so that parents might be able to get payments where, under the very strict rules at the moment, someone sitting in the NDIS service area will have to go through a whole lot of paperwork that will take forever. And yet we know there's good money. We know there are great organisations like Higher Up and other community-based organisations that desperately want to help, want to use new technologies, AI, flexible ways of working with people in the disability sector. They just need to be given the chance to do that with the money that's available creatively. And I think about all these people who are being isolated at the moment, the casual workers who aren't at work, who might actually be paid to get some low-skilled skills that they could then take back into these sectors as part of that surge workforce, get paid, get new skills, and actually relieve the pressure that's on the front line for families like Christina's and those that are in the aged care sector. And we've got so many people of goodwill who can be trained, be part of that, and a fund that's not even part of the 17 billion or the money to come, that sits waiting, ready to be used creatively. So I'd really encourage government, working alongside those in the sector, to think this is the time when Australians can be innovative, creative, and seek to serve the needs of the most vulnerable, because then we know that we'll actually be working with a system that can serve us all very well. And that's my test for whether we're going to operate as really great Australians through this and be innovative and use what's right before us and be gentle about this. Rather than thinking everyone's going to rort the system, start with trust and open things up to make things happen very quickly, so that Christina and other families around the country are not living with this fear and anxiety about what might happen.